Alright. Ready?
Oh, yeah.
No, I'm gonna edit it. Alright, ready? 3, 2. Hello, my name is Levi, and this is.
Hello, my name is Rigo.
And I am going to be performing a head-to-toe assessment on you. Do I have your consent?
Yeah.
Basically, it's gonna be non-invasive, minimally invasive. Just going to be making sure everything is normal or abnormal, and I'm going to be saying my findings as I do my assessment.
Okay.
Is that okay with you?
Yeah.
Okay, so first I have to establish that, lift up your right hand. That will be your right side, and this side will be your left side. So first things first is the general appearance. He's well kept. Hair isn't all shagged.
Shot this funny.
Okay, so nails not dirty. He doesn't look dirty. He's look clean. Clothes well kept. Smells pretty good.
I appreciate that.
Skin color appropriate for his ethnicity. No cyanotic in the fingernails or the lips, which is basically blueness in the lips, so that's normal. Let's see. So first things first, I'm gonna look at your head. I'm going to first inspect your head. It's fairly symmetrical. No deviations there, no trauma, no injury. And then I'm going to palpate your scalp. I'm just looking for any bulges, anything that's abnormal, feel any lesions or scabs, which I don't. And then we're gonna go to the cranial nerves 5 and 7, which is basically facial expressions and features. So I'm going to ask you to raise your eyebrows. Okay, so that's normal. I'm going to ask you to frown. That's
hard frown.
No, that was a good frown. And I'm gonna ask you to smile. Perfect. And then I'm going to place my thumbs over your eyelids, and then you're going to try to open them against the resistance of my thumbs. Okay?
Okay, you trying to, you said like raising?
No, just open your eyes, basically.
Oh, okay.
Yeah. Okay, perfect. So that's normal as well. So I'm going to test cranial nerve 5. Basically the sensation, I'm gonna ask you to close your eyes. I'm going to touch a part of your face, and then you're gonna tell me if you feel it or not and where.
Okay.
All right?
Left cheek. Right cheek.
Perfect. And then I'm going to palpate your masseter and temporal muscles, okay? So if you can chew, there you go, and chew, there you go. Nice and strong. He's a strong guy. Next is I'm going to test the eyes and the corneal light reflex, or the Hirschberg test. Basically, I'm going to shine a light in your eye. I'm going to ask you to look forward while I shine the light, and I'm seeing if the light reflects in your eye and a symmetrical point of your pupil. If the light in one pupil is off-centered and the other is centered, then it's a abnormal finding. But if they're both centered and equal, then it's normal. Okay, so this will be my pen light. Now just look straight ahead at me. Perfect. They're symmetrical. Thank you. And then we're going to be doing the uncover test. Basically, I am going to. Okay, so I'm going to be doing the uncover test. I'm going to ask you to look 10 feet ahead, which is to the opposite side of the wall. I'm going to cover one eye, and what I am looking for is, if I cover the eye and I tell you to look, that your cornea doesn't deviate, it stays centered. And basically, I'm looking for strabismus, or if your eye, or basically double vision, is what people will call it. So I'm gonna ask you to look straight ahead. I'm gonna cover this eye. That's a normal finding in the right eye, and I'm gonna cover the other eye. That's also a normal finding in the other eye. Now, I'm going to test your EOM, which is the extraocular movements of the eye. Are you able to move back a little bit? Thank you. So I'm going to test the corneal gaze. So basically, I'm going to ask you to follow my finger. I will be moving my finger in a slow, not slow, but smooth motion. And basically, I have to check to see if your eyes can look at all the gazes of your field. All right? So starting here. And that is normal. Basically what I did there was an H pattern and you passed.
Appreciate that.
Okay. So next, I will be checking your eyelids, your eyelashes, and your tear duct. Make sure that there are that there's no abnormal drainage coming from the tear duct, no lesions on your eyelids or lashes. Make sure your lashes are intact. Also, I'll be looking at your conjunctiva and your sclera, basically the whiteness, the white portion of your eye. Make sure that they're white, no injury or past injury is there. And then I'll be checking for perla, basically if your pupils are equal, reactive to light, symmetrical, and accommodating. So, yeah, we're gonna do that now. All right, so we're gonna get a little close and personal.
Exactly.
All right. Okay, I'm looking at his eyelids, which are normal. Eyelashes are intact. I'm gonna ask you to look up for me so I can look at your sclera and conjunctiva, which is good. I'm gonna ask you to look down. Okay, good. I'm gonna pull back your tear ducts. No drainage, that is also good. I'm gonna start with the perla now. So I'm just checking to see. You're gonna look straight ahead. You're not gonna look into the light. Cover one eye. His pupils did constrict when the light was there, which is normal. Same to the other eye, so they're both equal and reactive. I'm gonna ask you to follow my finger. It's gonna go towards you and then back. See if they can accommodate, which they can, which is good. And then I'm gonna look at your optic disc and your retinal background with this tool, the ophthalmology tool. Okay, so I'm gonna use this tool. It's gonna be a bright light into your eye. Basically, I'm checking for your optic disc and your retinal background. And then I'm going to switch the setting to see if there's a red light reflex. Basically, I'm trying to see if there's a red light that shines back at me, okay? All right, I'm gonna stand up for this. I'm gonna ask you to move aside, or I'll put a hand on your shoulder here so I don't bump into you, okay? Very nice. Okay, and then we're gonna switch positions. Pause. Okay. Okay, good. And I'm gonna switch it to 0 to see if the red light, which is good, and then the other side. Perfect. So those findings are also satisfactory. Okay, so next, I'm going to inspect your ears. So for this, I'm going to inspect the position, the size, shape, and symmetry to see if they're equal. And then I'm gonna feel your pinea and tragus. I'm gonna inspect the inner ear with a tool, kind of similar to the eye, but it's to feel, not feel, it's to inspect the canal. It's called an otoscope, okay? And then next I'm going to do a Weber test, a Ryan test, and then a whisper test to see how good your hearing is. So first, I'm going to inspect your ears, pull your pinea, inspect your tragus, no deformities there. Same with the other side, they're both symmetrical, pinea and tragus, intact, no injury. I'm going to inspect your inner ear with this device. Now, a little bit of wax, but that's expected. Same thing with this one. Good. All right. Now, I'm going to use this tool called a tuning fork. Basically, I'll strike the fork and I'm going to place it on your mastoid, and I'm gonna ask you if you can hear it, okay? You have any questions?
No.
All right. Ready?
Yeah. I can hear it.
All right.
I can hear it.
Now I'm gonna do the Ryan test. I'm gonna strike it and place it on top of your head. You have to let me know if you can hear it in both ears.
Okay. I can hear them both.
Which is expected. I'm going to do the whisper test as well. I am going to ask you to close your eyes, and then I'm going to whisper 3 words into your ear. Sorry, you're not going to close your eye. You're going to close the right ear.
Okay.
And then I'm going to whisper 3 words, and then you have to repeat those 3 words.
Okay.
All right?
Soccer food car.
Now, cover the other ear.
Table, chair, door.
Okay. That's satisfactory. Those are the words that I said. Now, for your nose, I'm going to inspect the shape, the symmetry of your nares. I'm going to palpate the bridge, feel for the soft tissue or the cartilage. I'm going to palpate your sinuses in your face, inspect your nasal cavity, check the patency, see if there's any septum deviation, and I'm going to test your sense of smell. All right, so I'm going to look at your nose. Your nose is symmetrical. I'm going to ask you to look up. Your nares are also symmetrical. And then now I'm going to palpate the bridge of your nose. Is there any pain when I press?
No.
Soft tissue, any pain when I press?
Mm.
Nice, satisfactory. And then I'm going to use a different setting or a different attachment to inspect Mr. Rigo's nose. I'm going to ask you to look up, and then I am going to inspect your nose with this device. Do you have any questions?
No.
Okay. If you can look up. Which is Peyton. I have a booger in the right nose, but. Sorry, no, you don't. Now I'm gonna feel your sinuses. You tell me if there's any pain. Any pain there?
No.
Pain there?
No.
Okay. And then your sense of smell. I'm going to ask you to smell this alcohol swab. And you're gonna tell me if you can smell it.
Yeah. Not that strong.
Okay. So now I'm gonna check your mouth and throat. I'm gonna inspect for symmetry, the skin, know the odor from your mouth. I'm gonna look at your gums. I'm gonna inspect your teeth, tongue. I'm gonna look at your tongue movements. And I'm gonna look at your hard and soft palate, make sure there's no redness. Look at your tonsils, make sure they're not inflamed or if they're absent. Have you had your tonsils removed?
Yeah.
Okay. And then I'm going to your gag reflex. I can tell that you have a gag. Yeah. And then I'm gonna assess taste. You're chewing gum,
Yeah.
but you can taste that. So now I'm gonna look at your mouth. If you can say ah. Okay. Symmetrical. No redness. He's chewing gum, so it smells like mint. If you can stick your tongue out, and then if you can point it up, and then down. Okay, good. And then left and right. Much. And then if you can say cheese, teeth, symmetrical, no missing teeth. And I did not see his tonsils. So the neck, I'm going to palpate for your lymph nodes, for your carotid arteries. I'm going to use a stethoscope to listen to your carotid arteries and your thyroid, making sure that there's no bruit. Basically, it's a sound if there's stenosis. All right? So if you can look up. Okay. Lymph nodes are not enlarged, which is good. I'm gonna list for your carotid. +2 and palpable. Now I'm gonna use my stethoscope, and I'm gonna feel for your thyroid. It's not enlarged, so that's good. I'm gonna listen to your carotid arteries. If you could look up. Thank you. No bruise there. Okay, good. Now, I'm gonna ask you to, I'm gonna look at your back, your posterior chest. I'm gonna look at the skin and look at the expansion, and I'm gonna test for tactile firmness. Basically, I'm gonna put my hands on your back. I'm gonna ask you to say 99. Each time I move, you're just gonna repeat the 99. I'm feeling for a vibration. All right? Okay, so I'm gonna inspect the skin first. I'm gonna lift up your shirt, make sure there's no moles or anything, no abnormalities, which I don't see. Now, I'm going to, okay. When I put my hands on your back, you're just gonna say 99, right?
99. 99. 99. 99.
Which is expected. He has some bass to it, so there's some vibrations in it. I'm gonna listen to your lung sounds in your back. You can breathe normal. Okay, now if you can turn this way, a little bit more. All right, now you're gonna take a deep breath. Okay, good. Deep breath. Good. Good. Okay. Now I'm gonna move to the front, starting with the top or the apex. Okay, and while I was listening to his lung sounds, I was counting his respirations, which were an 18, so that's good. And then we'll now listen to your heart sounds. I'll assess for JVD, which is jugular vein distension, which I don't see, which is satisfactory. I'm gonna listen to your arteries, your aortic, your renal, your iliac, femoral arteries, inspect and palpate your upper and lower pulses. And I'm gonna feel for your aortic pulse. I'm gonna try to listen for it. And while I'm here, I'm just gonna check bowel sounds as well. I'm gonna feel for your pulses here, and I already felt your carotid. And then you're gonna show me your back so I can listen to your renal arteries. All satisfactory. I listened to your bowel sounds. I felt your stomach. There's no distension. I have to percuss. Just tympanic. I'm gonna do a light press. Any tenderness? No. Deep press. Any tenderness? No. Okay. So then now the upper extremities, I'm gonna inspect your clavicles, your shoulders, your scapula, palpate your joints. Any tenderness in your joints, you just have to let me know. Palpate your hand, your range of motion with your wrist and your hips. Inspecting your clavicles, and you can show me your back. Feeling your scapula and your shoulders. Symmetry, any tenderness there?
No.
Okay, you're gonna show me your range of motion. You're gonna lift up your hand, both of them, and then you're gonna bring them like this with the wrist. You're gonna, and then towards you, and then up, and then down, which is good. And then the lower extremities, I'm gonna palpate your knees, inspect your knees, any pain when I press,
No.
and then assess your strength and your knees. Are you able to stand up from sitting down? And then I'm going to check your reflexes.